Diuretics are drugs which cause loss of sodium and water from the body via the urine. Okay, since it causes loss of sodium, it is also called as natriuretics. Diuretics or natriuretics. These drugs cause the loss of sodium and water from the body via the urine. Actually, these diuretics are removing excess sodium and water in the body. Okay, so its action actually won't cause any problem to the body, but it is actually removing the we give diuretics in case of any renal failure or some such conditions. So in such conditions, it removes the excess sodium and water which is present in the body via the urine. Okay. Now, based on the efficacy of these diuretics, they are of three types: high ceiling diuretics, medium efficacy diuretics, and weak or low efficacy diuretics. Now, examples of high ceiling diuretics are furosemide and bumetanide. Medium efficacy diuretics, the main example is thiazides. And we have the weak or the adjunctive diuretics. The weak diuretics examples are carbonic anhydrase inhibitor, osmotic diuretics like mannitol, and the potassium sparing diuretics. So today, mainly we will be discussing on high ceiling diuretics, that is furosemide. Other drugs which come under this group are furosemide, bumetanide, toracimide. Okay. Now, what are the peculiarities of this high ceiling diuretic of furosemide? Furosemide is a prototype drug in this group. So what are the peculiarities of furosemide? It is a drug which has a very prompt action. That is, if the drug is given via the IV route, we get the effect within 2 to 5 minutes. And if it is given via the IM route, we get the effect within 10 to 20 minutes. In orally given, it will take a little more time. That is, we get the action in 20 to 40 minutes. The duration of action is 3 to 6 hours. If furosemide is given, we get the duration, we get the diuretic action for around 3 to 6 hours. Now, where is this furosemide acting? It is mainly acting at the thick ascending limb of loop of Henle. Thick ascending limb of loop of Henle. Okay. Hence, it is also called as loop diuretic. Since it is acting at the thick ascending limb of loop of Henle, it is also called as loop diuretic. And if the dose of furosemide is increased, the diuretic response obtained will also increase. That means we can remove up to 10 liters of urine per day by giving furosemide. And another peculiarity of furosemide is, even in severe renal failure patients, furosemide is effective. Furosemide is effective even in severe renal failure patients. Okay. Now let's see what are the actions of furosemide at the nephron. But before going to that, we have to know actually what is happening at the nephron. A little bit of physiology. Only then you'll understand what furosemide is doing there. Okay. So we'll see what is actually happening there. The picture, don't look at the arrows. This, what is the picture? This represents the glomerulus and the renal tubule together called the nephron. Okay, so from the glomerulus, a filtrate is absorbed into the Bowman's capsule. That filtrate is called as glomerular filtrate. And that process is called as glomerular filtration. And this fluid will be passing via the renal tubule and it will be removed from the body finally. So when the fluid is passing through this lumen, some substances will be reabsorbed back into the body, and that is called as tubular reabsorption. And some substances will be secreted back to the fluid, that is called as tubular secretion. So in general, sodium, potassium, chloride, bicarbonates, uric acid, glucose, water are all reabsorbed back into the body. whereas urea and creatine are generally not reabsorbed and they are removed from the body. Okay. Now we'll just see what is happening to different minerals at different sites. First of all, we'll start with sodium. So you can see the first arrow. The marking is clear. Can you see the annotation used? The spotlight is clear. You can see the spotlight. Yes. Okay. Okay. Thank you. Thank you. So we'll see what is happening to different minerals at different sites. First of all, sodium. At the proximal convoluted tubule, around 60% of sodium is reabsorbed back into the body. Okay, around 60% of sodium. This I'm talking this about under normal conditions. Okay, this is what is happening under normal conditions in a healthy adult. Sodium, 60% of sodium is reabsorbed back into the body from this fluid. So in order to maintain the balance, body will have to give something back into the fluid. So body will give H+. H+ is exchanged in return for sodium. Sodium is taken in and H+ is given to the fluid. Now, from where is this H+ coming? It is actually a byproduct of breaking down of carbonic acid. Carbonic acid is broken down in the body to H+ and HCO3-, and this H+ is secreted into the lumen, and the sodium which is absorbed will come and combine with the bicarbonate. Okay, since this H+ is being secreted into the lumen, urine is mildly acidic. Okay. And also potassium. Potassium is also reabsorbed along with sodium at the proximal tubule to a certain extent. Now what is happening to bicarbonate? Normally it is not reabsorbed, but if the bicarbonate level in the body is low, bicarbonate will also be reabsorbed at the loop of Henle. Okay. Now let's see what is happening here in the loop of Henle. This is a thick ascending limb of loop of Henle. There we have a substance called as sodium potassium chloride co-transporter. Here we have a substance called as sodium potassium chloride co-transporter. And what is the function of this particle? The function of this particle is to reabsorb sodium and chloride back into the body. Okay, so it is present at the thick ascending limb of loop of Henle. Sodium potassium chloride co-transporter. The function of sodium potassium chloride co-transporter is to absorb sodium back into the body. Now moving to the next area, distal tubule, we have sodium chloride co-transporter, which will also promote the absorption of sodium back into the body from this fluid. Okay. Now you can see in the cells lining at the distal tubule, it is written potassium, potassium, potassium. Actually, at the distal tubule and collecting duct, the cells lining the distal tubule and collecting duct has potassium. Potassium is present at the cells lining the distal tubule and collecting duct. Potassium will just wait there. Now what happens is, when the fluid reaches the distal tubule or collecting duct, if there is excess amount of sodium in the fluid, what the body will do is, sodium will be reabsorbed into the body and the potassium which is present at the lining cells will be secreted to the fluid or to the lumen. Okay. Normally, by the time fluid reaches the distal tubule, almost a large percentage of sodium will be reabsorbed under normal conditions. But if by any other abnormal condition, if there is excess amount of sodium when the fluid is reaching the distal tubule or the collecting duct, what the body will do is body will always try to maintain a certain amount of homeostasis. So if there is excess amount of sodium in the fluid when it is in the distal tubule or collecting duct, body will reabsorb sodium into the back into the body, and in exchange for that, the potassium which is present at the lining cells will be secreted to the lumen and it will be removed from the body. Now let's see what's happening at the collecting duct. Normally at the collecting duct, nothing will happen. But if there is aldosterone present in the body, this aldosterone will promote the absorption of sodium, and in exchange, it will remove potassium from the body. If there is aldosterone, aldosterone will absorb sodium back into the body, and it will remove potassium from the body. Okay, so this is a renal tubule. This is what is normally happening. Sodium is absorbed at the proximal tubule, also at the ascending limb of loop of Henle. This is of concern to us because we are talking about frucimide. We know frucimide is acting at the thick ascending limb of loop of Henle. And here potassium is secreted. Okay, this is generally, I've not explained completely on urine formation, just the basic relevant parts with respect to frucimide. Okay, this is happening under normal condition. Now we are talking about an abnormal condition. That is why we are giving the drug, right? Renal disease. So if a person is having renal problem, what will happen is there will be excess amount of sodium and water retention in the body. Renal failure patients will have edema, right? So if a person is having renal disease, there will be excess retention of sodium and water in the body, which will result in edema. So to treat that condition, we give frucimide, the high ceiling diuretic. So what is the action of frucimide? We saw that it will remove excess sodium and water from the body. Excess sodium and water from the body. Okay, please note that it is not removing the normal sodium and water. If frucimide is given in the correct dose for the correct duration, it will remove only excess sodium and water from the body. So now that is clear. Now we'll see what frucimide is, what are the effects of frucimide acting on the renal tubule. Okay. You can see an yellow arrow. The yellow arrow. This is a site where frucimide is acting. So in the previous slide, we have seen that there is a substance here, a particle here called the sodium potassium chloride co-transporter, which is reabsorbing sodium and chloride back into the body. So the action of frucimide is to inhibit this sodium potassium chloride co-transporter. Action of frucimide is to inhibit this sodium potassium chloride co-transporter. That is why wherever you see frucimide or high ceiling diuretics, it will be written inhibitors of sodium potassium chloride co-transporter. Now you get that, right? So what will happen if the sodium potassium chloride co-transporter is inhibited by frucimide? Sodium chloride reabsorption is inhibited. There will be hyponatremia, dehydration. And we know since sodium reabsorption is inhibited, when the fluid reaches the distal tubule and collecting that, there will be large amount of sodium in the fluid. So what will happen? In exchange to that, sodium will be reabsorbed back into the body to a certain extent. And in exchange to that, potassium will be removed from the body. Yeah, we are giving frucimide to remove all the potassium, or remove all the sodium from the body. But a body has a certain homeostatic mechanism. That is why whenever there is excess sodium present in the distal tubule or collecting that, body will try to reabsorb some sodium. Okay. So in exchange to that, now we have large amount of sodium because here the absorption is not taking place. So in exchange to that, potassium is actively secreted from the body. That will result in hypokalemia. That is a bit serious condition. Hyponatremia, body itself will adjust to a certain extent, but because of this potassium secretion, there will be hypokalemia. Also, frucimide will increase excretion of calcium and magnesium, which will result in hypomagnesemia, hypocalcemia. Okay, so frucimide will reduce the amount of sodium, potassium, calcium, magnesium, everything. Another exception is only uric acid. Since why there is hyperuricemia? Action of frucimide is to remove sodium and excess water from the body. So because of removing excess water from the body, the extracellular fluid volume will be reduced. Because of the reduction in the extracellular fluid volume, uric acid, because of the reduced osmolarity, uric acid, body will redirect to absorb a certain amount of uric acid back into the body, which will result in hyperuricemia. So only the level of uric acid is being increased. Rest everything is reduced. Hyponatremia, hypokalemia, hypomagnesemia, hypocalcemia, but uric acid level is increased. And also another action is it inhibits the carbonic anhydrase enzyme. What is the function of carbonic anhydrase enzyme? It breaks down carbonic acid into H plus and HCO3 minus, and this bicarbonate is reabsorbed back into the body. Since this carbonic anhydrase enzyme is inhibited by frucimide, this reabsorption won't take place. And so there will be a mild alkalosis in the urine. Since frucimide inhibits this carbonic anhydrase enzyme, this reaction is not taking place. So bicarbonate is not reabsorbed back into the body, which means it is removed from the body. And so there will be mild alkalosis of the urine. It does not happen under normal conditions. Okay, this happens only if frucimide is given in high doses. Okay, so now what are the uses of frucimide? Now you know what it is doing. What frucimide is doing. Now what are the uses of frucimide? First and foremost, it is used to treat edema of any sort. Frucimide is used for the treatment of edema of any cause, either cardiac, due to cardiac cause or hepatic cause or renal cause, because it rapidly removes fluid from the body. So in acute cases, frucimide is given. Another important use of frucimide is in case of left ventricular failure and pulmonary edema. Why left ventricular failure and pulmonary edema? This is just a pictorial representation of the right atrium where vena cava is bringing the blood. We have the right ventricle. The blood from right ventricle is passing via the pulmonary artery. You know all this, just revising. Pulmonary artery to the lungs, and via pulmonary vein, it will reach the left atrium and to the left ventricle, and blood is pumped via the aorta to the whole body. Okay, this is normally taking place. Now we have two conditions like left ventricular failure and pulmonary edema. What happens in left ventricular failure? In left ventricular failure, the heart will be very weak and the ventricle won't be able to pump sufficient amount of blood to the aorta, thus to the whole body. And since left ventricle is not able to pump sufficient amount of blood to the aorta, what happens is blood will get pulled out here, and there will be certain extent of backflowing of blood via the pulmonary vein, and it will get accumulated in the lungs, resulting in pulmonary edema. Okay, in left ventricular failure, what happens is left ventricle is very weak. It is not able to pump. It does not have sufficient capacity to pump blood into the aorta. So blood will get pulled out here. So there will be a certain amount of backflowing of blood via the pulmonary vein to the lungs, and there will be edema in the lungs. That is called as pulmonary edema. To treat these conditions also, we give frucimide. What will happen when frucimide is given? One action of frucimide is, we have seen what frucimide is doing at the renal tubule, like hyponatremia, hypokalemia, all that we have seen. Now, apart from that, frucimide is having some other actions also. That is, frucimide increases the venous capacitance. What is the significance of that? Venous capacitance is increased. So there will be sufficient space or room for the blood to be pooled up in the veins, which means the amount of blood reaching back via the vena cava will be reduced. So it will reduce the blood reaching the aorta. Blood reaching the heart, because there is heart failure. So the heart does not need not have to take a large amount of stress. The load, cardiac load, will be reduced to a certain extent. That is one action. So since the cardiac load is reduced to a certain extent, the left ventricle will not have to take severe force to pump the blood, because the blood reaching is already low. So left ventricle will not have to take too much strain to pump the blood. In that way, it reduces the left ventricular filling pressure. In that way also, that is also one of the action of frucimide. And another action of furosemide in pulmonary edema is, we know furosemide removes excess water from the body, rapid removal of excess water from the body. So it helps in relieving pulmonary edema also. It is used in left ventricular failure also. And it is also used in treatment of pulmonary edema. Now, another action of furosemide is hypertension. This diuretics are also combined with antihypertensive drugs. So in antihypertensive therapy, one of the drugs is diuretics also. Now it is a regular use. Now it is used regularly in it is a regular part of antihypertensive therapy. Okay. Now what are the adverse effects of furosemide? Adverse effects of furosemide. First, and we know it is reducing the level of everything in the body, like so hyponatremia, hypocalcemia, everything is there. Among that, hypokalemia is of more significance because body is actively removing potassium from the body, not the excess potassium. Okay, it is actively removing the normal potassium from the body, which will result in hypokalemia. And what are the effects of hypokalemia? There will be weakness, fatigue, muscle cramps, and even cardiac arrhythmias can be formed. What is the management treatment for this hypokalemia? Either we have to give dietary supplements or potassium supplements, or combine furosemide with potassium sparing diuretics. Okay. This is of main concern. Among all the adverse effects, hypokalemia is something which is of main concern to us. Now, what are the other adverse effects? Acute saline depletion. We know it is, we are giving furosemide to remove sodium from the body. But if furosemide is given in large doses for a long duration of time, there will be acute saline depletion from the body. Another adverse effect is dilutional hyponatremia. What is dilutional hyponatremia? We know furosemide removes a large amount of fluid from the body. We know it is actually, if it is given normally, properly, it will remove the excess fluid from the body. But if furosemide is given in large dose for long duration, it will remove large amount of water from the extracellular fluid. Because of a less fluid, it will cause dilutional hyponatremia. A sense, or that is a false feeling of fluid is less. Okay. Gastrointestinal and CNS disturbances. There is severe nausea, vomiting, dizziness, headache. Another adverse effect is hearing loss. There will be allergic manifestations like photosensitivity, itching, rashes. That is common with any drug. Hyperuricemia, which will result in gout. We know hyperuricemia is one of the adverse effects of furosemide. Hypocalcemia and magnesium depletion is happening normally, but if furosemide is given in large dose, that will be a problem. And the final part, we'll see what are the drug interactions of furosemide. Furosemide is a diuretic drug. It is having certain drug interactions. We'll see what are the drug interactions. Before, in the previous slide, we have seen diuretics are always, nowadays diuretics are a part of antihypertensive therapy. So when diuretics are combined with hypertension drugs, the antihypertensive effect is added on or potentiated. So it is actually a good one. Diuretics are nowadays made a part of this antihypertensive therapy. Now, we have seen that furosemide, one of the main adverse effect of furosemide is hypokalemia, right? We know one of the main adverse effect of furosemide is hypokalemia. Now, imagine that this patient in whom we have given diuretic and there is hypokalemia, this patient is a cardiac failure patient. So definitely for a cardiac failure patient, digoxin will be given. Digoxin is usually included in the therapy or management of cardiac failure patients for cardiac failure. So what will happen? We have given diuretic, and because of the as a side effect, adverse effect of diuretic, the patient is having now hypokalemia. Since the patient is also having heart failure, patient is on digoxin. This digoxin is actually removed from the body or taken back removed from the body via a receptor which is potassium mediator. Okay, under normal conditions, for a heart failure patient, digoxin is given. Digoxin will do its necessary action, and after the necessary action, every drug has to be removed from the body, right? So digoxin is removed from the body via a receptor which is potassium mediator. Now what will happen? We don't have potassium because there is hypokalemia. The patient is already on diuretic and the patient is having hypokalemia. So what will happen? Digoxin will not be removed from the body. There will be digoxin toxicity in the body. That will result in, if there is excess amount of digoxin in the body, it will cause arrhythmias. We have given digoxin for treating cardiac failure, and because of the injudicious use of diuretic, we have caused, there is hypokalemia, not injudicious use, not combining it properly, there will be hypokalemia. So if diuretic is, it should be given very cautiously for a cardiac failure patient who is on digoxin, because it will promote digoxin toxicity, which will result in arrhythmias. And another effect of this hypokalemia is it increases a ventricular tachycardia. It also prolongs the QT interval in ECG. Another adverse effect is, do you remember from the from your pharmacology side, that is aminoglycoside is a antibiotic which causes ototoxicity, nephrotoxicity. So if a patient is on furosemide also we have seen in the adverse effects section, furosemide will also cause ototoxicity to a certain extent. So if a patient is on furosemide, never administer aminoglycoside antibiotic to that patient, because the effect of ototoxicity will be added on. Both are causing ototoxicity, ear toxicity. So that effect will be added on. Never add furosemide to a patient on aminoglycosides. Another interaction. We have, you know that while writing medications, you'll be advised like never write NSAIDs for a patient for a renal failure patient, right? Why? Because NSAIDs normally act by inhibiting prostaglandin. We are giving NSAIDs for an anti-inflammatory action, and this anti-inflammatory action is by inhibiting prostaglandin. That is on NSAID know to inhibit inflammation by inhibiting prostaglandin. Okay. Now what happens is, diuretic is having a hemodynamic action. That means it promotes the diuretic is something which is removing excess sodium and water from the body. So in different stages, we are seeing different actions of diuretics, right? Diuretic also increases the blood flow towards the renal tubules. That is also another one action of diuretic. Okay, diuretic also increases the blood flow to the renal tubule so that more amount of filtrate is formed and more amount of filtrate is removed from the body. The purpose of intention of diuretic is to remove excess sodium and water from the body. So in order to achieve that, diuretic will it has a hemodynamic action, increasing the blood flow to the renal tubules so that more amount of filtrate, glomerular filtrate will be formed, and it is possible to remove large amount of filtrate. Okay, this hemodynamic action of diuretic is also mediated by prostaglandin. This hemodynamic action of diuretic is mediated by prostaglandin. So what will happen? We are giving NSAID. Prostaglandins are all inhibited. There is no prostaglandin. So the hemodynamic action of diuretic will be reduced. Or in other words, the diuretic effect will be reduced. Patient will have edema. Proper fluid won't be removed. The necessary fluid won't be removed from the body, and patient will have edema. So never combine diuretic with NSAIDs. Sorry, never give NSAIDs to a patient who is on diuretics. Another drug interaction of diuretic is diuretics and probenecid. Probenecid is a drug given to treat gout. But when diuretic is given, This diuretic will inhibit the action of probenecid, uricosuric action of probenecid, and probenecid will inhibit the diuretic action of diuretics. Both of them will inhibit each other's action. So never give diuretics in case of, never combine diuretic with probenecid. We have seen that one of the adverse effects of diuretic is hyperuricemia or gout. So if there is such a condition, don't give probenecid, give allopurinol. Allopurinol and diuretic given together, they don't inhibit each other. But probenecid is also a drug given for the treatment of gout. Okay, but if there is hyperuricemia induced by diuretic, don't give probenecid, because probenecid will inhibit diuretic action and diuretic will inhibit the probenecid action. So give some other drug for the treatment, such as allopurinol. So that's about the high ceiling diuretic. Now let's see the questions. Okay, we'll discuss a few questions. So please try to attempt the give the answers. Diuretics cause loss of I can see the answers. Yeah, actually that is why this question is given. Okay, actually this was a question asked in a previous year. Actually, it should have been formed in a little more better way. I told you, when we discuss the adverse effects, when we discuss the actions of diuretics of furosemide, we told diuretics are removing, diuretics definitely is causing hyponatremia, hypokalemia, hypocalcemia, hypomagnesemia, everything is there. But diuretics are actually removing excess sodium and water from the body. Okay, actually diuretic is removing excess sodium and water from the body. Right? This is a very tricky question. It is actually removing excess sodium and water from the body. If we give diuretic in the proper dose for proper duration, only the excess sodium and water will be removed from the body. But even if we give the exact dose for exact time period, there will be loss of potassium from the body. Yes, very good. I can see the answer. Yes. Okay. Yeah, definitely you'll be confused. That's why this question is given here. If diuretic, even if diuretic is given in the furosemide is given in the normal dose, normal duration, there will be loss of potassium from the body. So hypokalemia, in the adverse effects section we discussed hypokalemia. That is one of the worst adverse effects of diuretic. So that's why when we are dealing with the entire topics on diuretic, we'll understand always this high ceiling ones are clubbed with potassium sparing diuretics. Or potassium supplements are given whenever high ceiling diuretic or moderate diuretics are given. Always potassium sparing diuretics are added on with that. Okay, so diuretics cause loss of potassium. Answer is C, potassium. Yeah, definitely. It is also, yeah, that's why I told you. Diuretics means it is removing sodium and it is removing water. That's why this question is actually not formed in a full way. This was taken from a previous year's question paper. If there is no potassium here, then we can go for sodium. If potassium is not there in the option, you can go for sodium. Okay. The question is very tricky. Like it is actually, diuretic is actually removing excess sodium and water from the body, not the normal sodium and water. Body always tries to restore the normal sodium and water to a certain extent. That is why we have seen, like we have given diuretic at the thick ascending limb of loop of Henle sodium chloride reabsorption inhibitor. So when the fluid reaches distal tubule and collecting duct, body somehow tries to maintain the homeostatic mechanism. So whenever fluid reaches there in the last portion, distal tubule collecting duct, if there is excess sodium there, again body will try to reabsorb it. Okay, so actually it is causing loss of potassium. Under that, this happens under normal conditions. Normal dose of diuretics we give, it will cause loss of potassium from the body, and that is of high concern because it will promote cardiac arrhythmias. If potassium is not there in the option, we can go for sodium. Okay. Very good. So you have understood that. Definitely, if you have understood, this doubt will be there. Okay. In detail, we'll discuss it in the regular class. Which of the following is not caused by frucimide? Hypokalemia, hyperuricemia, hypercalcemia, hyponatremia. Yes. Yes. Hypercalcemia. Hypercalcemia is not caused by frucimide. We know frucimide is causing only hyperuricemia. Rest everything value is decreased. Yes, very good, very good. All the other values are being decreased. Now I'll add on another point. We are discussing on high ceiling diuretic, right? Frucimide. Next in the group is medium efficacy diuretics or thiazides. One of the main difference between this high efficacy frucimide and medium efficacy thiazides are thiazides will cause hypercalcemia. Thiazides will cause hypercalcemia. How? We'll see in the regular class. Okay, when we are seeing the action of thiazides. So here the answer is hypercalcemia. Frucimide will not cause hypercalcemia. Answer C, hypercalcemia. Highest efficacy is seen. Frucimide, mannitol, trimetrin, hydrochlorothiazide. Yes. Frucimide is a highest efficacy diuretic. And one more point to add on that is, under the high efficacy diuretic, yes, very good, very good. I can see the answers. Under the high efficacy diuretics, we have frucimide and bumetanide. Okay, so if bumetanide is there in the option, go for bumetanide because bumetanide is more efficacious than frucimide. That is another drug in the group. Under the frucimide is a prototype drug in that group. We are mentioning mainly in the name of frucimide, but another high ceiling diuretic is bumetanide. So bumetanide is more efficacious than frucimide. Just note that point. So if there is bumetanide in this option, go for bumetanide and not frucimide. True regarding frucimide. Yes. Can be used in acute pulmonary edema, causes hypercalcemia, hyperkalemia, hypermagnesemia. Now it is clear, right? Very good. Now, I'm adding on one more thing. Normally, when you are reading on frucimide, we will see the actions like hyponatremia, hypokalemia, hypomagnesemia, hypocalcemia. All these actions will be seen everywhere. You will read, you will come with questions based on these things: hypocalcemia, hypokalemia, hypomagnesemia, like that. Now, just imagine that if you know only that, then how will you attempt this question? Because you don't know anything about left ventricular failure or pulmonary edema, you don't know anything about that. You just know frucimide is causing hyponatremia, hypokalemia, hypomagnesemia. That is the normal thing you will get when regarding frucimide from our UG knowledge or from your pharmacology classes. When you studied for UG, these things will be familiar, right? So you can eliminate the options like it is not causing hypercalcemia, it is not causing hyperkalemia, it is not causing hypermagnesemia. So definitely answer should be A. Like that also you can attempt MCQs. If you know all the other options, if you know that all the other options are not the answer, then you can go for the remaining one. Okay. Here you know it is acute pulmonary edema, right? Now we'll see the last question for today. Diuretic that could be considered appropriate for combining with ACE inhibitor. Spironolactone, frucimide, hydrochlorothiazide, mannitol. What is ACE inhibitor? ACE inhibitor is an antihypertensive drug, angiotensin converting enzyme inhibitor. That is, it is an antihypertensive drug. Yes, this is the last question. Yeah, I can see the right answers. Why hydrochlorothiazide? Why option C, hydrochlorothiazide? We were talking about frucimide for this much time. We were talking and discussing on frucimide. So why, as an antihypertensive therapy to be combined with ACE inhibitor, hydrochlorothiazide is given? Yeah. Yeah, it is. Hydrochlorothiazide is definitely a medium efficacy drug. That is true. And another reason is, in the first slide on Frucide, we have mentioned that, yeah, one positive side is when we give Frucide, we get the action within 2 to 5 minutes. But remember the duration of action of Frucide? Remember what was the duration of action of Frucide? It is very efficacious one, but the duration of action is only 3 to 6 hours. 3 to 6 hours. Yes, very good. Frucide, duration of action of Frucide is 3 to 6 hours. So imagine if a patient, hypertension means it is a sort of chronic condition, right? A patient is on antihypertensive, patient will be on antihypertensive for a long duration. So is it possible for the patient to take Frucide every 3 to 6 hours, going and taking Frucide? That's not practically possible. So we need a drug, we need a diuretic, which is a little more long acting to be combined with antihypertensive therapy. There we have hydrochlorothiazide. Yeah, definitely it is the efficacy is a little bit lesser compared to Frucide, but hydrochlorothiazide duration of action is around 6 to 12 hours. So BD dose will be sufficient. BD dose will be sufficient, and we get the duration of action for around 6 to 12 hours. That is why, even though hydrochlorothiazide is a medium efficacy one, we are giving it to combine with AC inhibitors or antihypertensive drugs. But if there is hypertensive emergency, definitely we should go for. If there is hypertensive emergency or severe edema or severe rise in blood pressure, then we'll have to give Frucide. Yes, very good. Then we'll have to give Frucide. Otherwise, for the regular therapy, regular antihypertensive therapy, usually medium efficacy one, thiazide is given. Answer is option C, hydrochlorothiazide. Okay. So with that, we wind up. I hope this session was useful for you. This is how. Okay, I think you have a doubt. Frucide is a high efficacy one. Hydrochlorothiazide is a medium efficacy one. That is true. But Frucide has a duration of action for only 3 to 6 hours. It gives prompt action in 2 to 5 minutes. If the drug is given within 2 to 5 minutes, we get the action. That is true. But for Frucide, the duration of action is only 3 to 6 hours. Whereas hydrochlorothiazide, or the medium efficacy one, the efficacy is a little bit less, but we get the duration of action is around 6 to 12 hours, which means the reduced sodium level, we get that diuretic action for around 6 to 12 hours for more time. That is why for the regular therapy with antihypertensive, to combine with antihypertensive drugs, instead of Frucide, thiazide is given. Because if Frucide is given, we will have to give regularly, we will have to give this Frucide every 3 to 6 hours. Patient will have to take every 3 to 6 hours Frucide for a long time in his life. That's not possible. So we are giving a drug which is a little more, which is having a little more longer duration of action. Yes, probenecid. Actually, probenecid is a drug which helps to, which is used for the treatment of gout. Gout is a condition where there is excess uric acid in the body. So to treat gout, or the condition where there is hyperuricemia, probenecid is one drug. And at the same time, allopurinol is also another drug. Okay. To treat gout, probenecid is also given. Allopurinol is also given. But we know when a diuretic is given, there will be hyperuricemia. So if there is severe hyperuricemia, definitely we'll have to give some drug. Okay, but don't give probenecid. Why? Because this probenecid will reduce the diuretic action of Frucide. And at the same time, Frucide will prevent this probenecid from removing uric acid from the body. Both of them will oppose each other's action. Both of them will oppose each other's action. So They should not be combined. So if there is hyperuricemia due to furosemide, don't give probenecid, give some other drug such as allopurinol. Okay. Mannitol is a drug which comes under osmotic diuretic, that is low efficacy diuretics. Low efficacy diuretics we'll discuss in detail in the regular class. So actually this is how you deal with a topic. Okay, furosemide, now you know about furosemide. Now when you're learning about medium efficacy diuretics and low efficacy diuretics, everything will be learned comparing with this one. So it will be easy to remember. Like I told you, hypercalcemia is an effect of, that is the difference between furosemide and thiazides. Furosemide will cause hypocalcemia, that we know, but thiazide, only different, one of the difference between furosemide and thiazide, the medium efficacy one, is thiazides will cause hypercalcemia. Okay. So the medium efficacy ones and the low efficacy ones, like this is how we'll compare the differences and learn. Right? So if you learn a little bit of theory with respect to that topic, then it will be easy to solve the questions. You'll be more confident in dealing with the MCQs. The remaining diuretics we'll be discussing in the regular class. Okay. So with that, I think we'll wind up now. I hope this session was useful for you. So thank you all of you. Thank you all of you for the you were very nicely responding. So thank you so much.